The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
It's a place that no one ever wants to be or expects to be, because when you have a baby, the expectation is always balloons.
Today is all about baby. We'll be answering your questions about pregnancy, childbirth, and what happens when things don't go exactly as planned. Good afternoon and welcome to Rex on Call Live on WRAL. I'm Kim Dean Holderness with Rex Healthcare. From pregnancy to delivery to those first sleepless weeks at home, if you have questions about babies, give us a call. Your questions may be answered here live on our program by our experts. To call us here at Rex on Call, just dial the numbers on your screen. In Wake County, 919-744-3876. If you're outside of Wake County, call us toll-free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us your question at Rex Healthcare using the hashtag RexOnCall. The experts answering your questions today are Dr. Ann Collins, an OBGYN with Center OBGYN, and Dr. Marie Ambrose Thigpen, a Rex neonatologist. They will answer your questions in a moment. But first, what happens when things don't go exactly as planned? When babies arrive too early or have other needs in those first few days, they go to Rex's Special Care Nursery. Here's more on how this special place helps not only the little ones, but their families too.
This special care nursery at Rex Hospital is not a place parents plan to go.
Well, not at all. I thought I would get to go to home with him today.
Her baby boy, Caden, is having problems maintaining necessary sugar levels.
We're trying to raise them up, but they keep going. They're not very constant right now.
Though disappointed to be here, Gabby is thankful to have the support her baby needs. Babies here often have respiratory issues, trouble maintaining body temperature, or feeding problems.
Yeah, you're doing good. Yeah, you see?
We support them in whatever way they need until they mature and recover from whatever process is going on and are well enough to go home.
And all of this care starts with the parents.
It's a place that no one ever wants to be or expects to be, because when you have a baby, the expectation is always balloons.
Parents who have had babies in the special care nursery have formed a parent advisory council to help current parents through the process.
That's what Rex does extraordinarily well. We want our parents empowered. We want to recognize that there is fear there, but early on, engage them in the conversations about their baby's care. It is so important for them to have that role as mom and dad right from the very beginning.
The fact that I didn't get to see him every hour, it's weird at first, but everybody's so friendly and stuff, so you get used to it. Love the nurses. They're always there whenever you need them, whenever you need to talk to them, any questions.
Those little babies, I don't even know how you stand it. Okay, we're talking about issues surrounding motherhood, and we pay a lot of attention to baby in those first few weeks there, but what are some signs for the moms that we need to be looking at for, say, postpartum depression? What do we need to be aware of?
Well, I think there's a couple of things. I tell people it's not uncommon to have the baby blues, especially in the first few weeks. You're sleep deprived, you're dealing with something you had no idea potentially how to take care of. But if it starts to interfere with your daily activities and you feel like you just can't do what you need to be doing during the day, then that's a time that you should talk to your physician. If it continues past that 6 weeks time frame, those are things to be more concerned with. And certainly if you ever have feelings of hurting yourself or harming your baby, you should call 911 or call the nearest support person you have to come and help you.
Absolutely, absolutely. Now, and one of the, you mentioned sleep deprivation. It is real after a baby comes. And so babies, they are up every, I mean, in my house it was every 90 minutes, but very frequently. Tell us why.
Well, babies need to eat frequently, and if you're a breastfeeding mother, a lot of times the breast milk goes through the system a lot quicker, a little quicker than formula would. So babies need to eat frequently in order to grow and maintain an adequate hydration status. So they will wake you up every 2 to 3 hours. And at certain periods of time in the first couple of weeks, they experience what's called a growth spurt. At that point, they will want to eat more frequently, which is probably why yours were getting up every 90 minutes.
Yes. Yeah, and sleep deprivation, that is real for sure. And we talked a little bit about that, but the Rex and the special care nursery, there's a parents advisory council. Talk to us about how you involve the whole family in that process when babies are there.
Well, a lot of NICUs, and especially I see this at Rex, we include the families in the care for the babies. It's family-centered care. So we encourage parents to be present during rounds. It used to be rounds were this protected time where the medical staff would, talk about the babies and their medical issues using very complicated medical terms. But now the push is to have the families involved in a lot of the conversations, be involved in the decision making, keep them up to date on the plan. And I think the parents feel that when we include them, that they're doing something for their baby, because as the video had shown, parents don't expect to be in the special care nursery. So a lot of times they feel a little helpless. And so by having us include them in day-to-day care, they feel like they're actually doing something for baby.
Absolutely, absolutely. And we talked a little bit about, there was a trend for quite some time to induce labor at 39 weeks. And that was, I feel like when I was having my babies, that was a trend. No more.
Well, what we've tried to get away from is something called an early term delivery, and technically term deliveries are from 37 weeks on. And even though those babies generally do quite well, we know that women who go into labor on their own have babies that do better sometimes than women who are induced, unless there is a medical necessity.
Right.
And that you do see those 37 and 38 weekers that sometimes need to be in the special care nursery, when if we had waited another week or 2 weeks and let them come on their own, there's less of a chance that that would occur. Now, having said that, you don't just go forever to wait for your baby to come either. Most of the time we're going to look at delivering around 41 weeks.
Okay. Yeah, because you can't, at 39 weeks you feel like you're ready to, you definitely feel like you're ready to go.
You're pretty miserable in August when it's in July when it's 100 degrees outside.
I know, so yeah, it's hard to negotiate that.
Babies,
absolutely.
I tell people babies come when they're ready. And unless there are other overlying medical circumstances, we try to need to let things do what they're supposed to do on their own and naturally.
And just to add to Dr. Collins' comments, when babies are electively induced prior to 39 weeks, there is a greater chance that they will end up needing special care services because there is a higher incidence of breathing problems and also poor feeding in those first few days. And now we have to take the baby into the NICU, separate the baby from mother, which is not ideal.
Yeah, and so what are the most common reasons why a baby ends up in the special care nursery?
The main reason is prematurity. So any baby for us who is less than 35 weeks completed gestation would come into the NICU. And that is more so we can see if the baby can handle its transition into the world. Can they breathe on their own properly? Can they eat? Can they maintain their temperature and their blood sugar levels? So those reasons for a baby who's about 34 weeks would necessitate them coming into the NICU. So our first main reason is prematurity. Secondly, other babies come into the NICU for any sort of illness, any low blood sugars, any breathing abnormalities, whether it's some blueness or rapid breathing. Any baby who's essentially ill has to come into the NICU for further monitoring.
Well, such a special job you guys do there. The babies are so cute. Okay, we are back after the break to answer more of your questions on everything from delivery to why those newborns, again, why are they up every 2 hours? To call us here at Rex on Call, just dial the number on your screen. In Wake County, call 919-744-3876. Outside of Wake County, toll free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. Stay with us. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on everything baby. If you have questions for our experts, call in now. Those numbers are on your screen in Wake County, 919-744-3876. Outside of Wake County, calls toll free 877-277-6252 or email us your questions if that's easier to rexoncall@rexhealth.com. Let's get to these questions. How long does postpartum depression last? What are some symptoms they should be looking for?
Again, we touched on this a little bit briefly earlier. I think in general, not feeling like yourself, not feeling like you're able to continue to do your daily activities because of not feeling well, not having any sense of pleasure, not sleeping well, regardless of whether the baby's keeping you up. And certainly if you're going to harm yourself or harm your baby. How long it lasts, it depends. Most people feel like if you're going to treat, you should treat for at least 3 months and then reevaluate and decide at that time, is it time to come off of any medications. There's also a very good postpartum depression support group that Rex helps work with. That is fabulous to use, and sometimes it helps people just to talk about it.
But there are treatment options. There's talk therapy, that support group, but also medically, there's medication.
There's medications that are totally safe with breastfeeding, that you can continue to breastfeed your baby, and many, many options available. Speak to your physician.
And this was a family member who was asking, which is great, because sometimes the person who's going through it.
It's absolutely right, and sometimes a family member can see that and suggest, I think you should go talk to somebody, and I think that's very productive.
Got to watch out for those moms out there. Okay, this is questions from Chapel Hill. Five-week-olds breastfeeding, but using the nipple board as a pacifier, when not nursing. What do you think about that?
Well, there are a few reasons why babies cry. Primarily they're hungry, and so we feed them. Sometimes it's a dirty diaper. Other times they want to be held. I used to tell parents that you can't spoil your baby prior to 6 months because it's part of their need to be held. And other times they need to suck. They don't necessarily need to eat for nutrition, but they do need to have that non-nutritive sucking is what we call. And this is where usually a pacifier would come in. Other times, there are babies who go through these growth spurts, which we touched on before. So I would advise her, of course, to always chat with her pediatrician, but there are a number of reasons why babies would want to suck, and sometimes the non-nutritive sucking is just for comfort.
But you're on the pro-passy bandwagon. Pacifiers are good?
I think pacifiers are okay. I know a lot of people are afraid to give pacifiers because they think it might interfere with the breastfeeding, but it sounds as if this caller's baby is breastfeeding very well and may benefit sometimes from using a pacifier just for that calming.
That calming. I would have sent my kids to college with a pacifier if they would have taken it, but they just, anyway. This question's from Raleigh. What are steps to take when first considering to get pregnant? What should this person do?
Well, I think that's a very good question. I think it's always important to speak to your gynecologist and tell them you're interested in getting pregnant. Let them talk to you about your history, if there are concerning aspects of your history that needed to be addressed, and more importantly, ask about your family history. Are there illnesses that run in the family, sickle cell anemia, cystic fibrosis? Based on your ethnicity, are you more likely to have a gene for certain diseases? And then you want to be on a prenatal vitamin or folic acid prior to conception, so that helps prevent neural tube defects like spina bifidus. Very important. And then you just start trying. And obviously, no alcohol. If you're a smoker, you should try to quit smoking. If you have other medical illnesses like diabetes, you want that to be as tightly controlled as possible. If you are hypertensive, you want to make sure if your blood pressure is up, you're on a good medication that is safe in pregnancy.
Yeah, talk to your OB.
And so if you come into your OBGYN, they can go over all of that with you ahead of time.
That's great information. Okay, we're going to get to more of your questions after the break. But first, there are times when pregnancies don't go exactly as planned or they're deemed high risk. In those special cases, moms can be taken to special care at UNC Maternal Fetal Medicine at Rex. The same specialists practicing in Chapel Hill also see patients in Raleigh. Sometimes a pregnancy can be complicated by diabetes, hypertension, or congenital abnormalities with the fetus. These specialists are known for the state-of-the-art diagnostics and also, if necessary, complicated surgeries for both mother and the fetus.
One of the things that we're able to offer with this practice is that next level of high-risk prenatal diagnosis and care for high-risk pregnancies that is usually found in large academic centers.
I'm a little bit older, and it's twins, and we wanted people who knew twins, thought about twins in their sleep. We just didn't want to have second, if we'd only done this kind of a thing. So we just wanted people who knew it, knew their specialty.
And boy, do they know it. If you have any questions about pregnancy, delivery, postpartum concerns, anything about baby, call in now. Call us here at Rex on Call. Just dial that number on your screen. In Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. We'll be right back. Welcome to Rex on Call here live on WRAL. Today we're answering your questions on everything baby. To call us here, just call one of those numbers on the bottom of your screen or email us your questions to rexoncall@rexhealth.com. Let's get to these questions. From Amanda and Wendell, can newborns be given Tylenol after they have shots?
Well, I would always advise someone to talk to their pediatrician because they can give you appropriate dosing, but in general, it used to be that Tylenol was given automatically after vaccines, and then studies started to show that maybe that had an effect on the immunogenicity, so how effective the vaccines were. So now it's more recommended that if the baby has symptoms, if the baby has a fever and is cranky and doesn't want to eat or has some pain, then yes, correct, but not preemptively.
Because it's not on the back.
Correct, you have to call.
Yes. Okay, Crystal from Rocky Mount, she's pregnant. She passed her first sugar test, did not pass her second sugar test. So she wants to know what's the normal level and what happens next.
Well, it depends on the test, but generally they're very standardized testing, and without knowing her levels, I can't tell you how abnormal they were. But diabetes is very common in pregnancy, and all pregnant women are tested for diabetes at around 25 to 28 weeks. If you fail the first test, unfortunately you get a 3-hour test that's not a very fun test to do. However, it is very good at picking up diabetes, which can be extremely important for how well your baby does after delivery and whether it ends up in the special care nursery or not. If your sugar tends to be high, baby sugar may be low at delivery, and that can cause problems and put the baby in the nursery. We are seeing a little bit more of gestational diabetes, especially as the obesity epidemic increases and women are overweight. It also can be if it runs in your family.
Okay, good information. The call's from Raleigh, and hey, this is a great question. With so many good hospitals in the area, how do I choose the hospital to deliver my baby? That's a great problem to have, right? So many great choices.
It is a great problem because there are lots of places in the state that don't have the access that we have. I think you need to look at, number one, what we just showed earlier. Do you have any complications of your pregnancies? Do you need to be at a university academic center because of a congenital anomaly and the baby may need surgery, or a really unusual problem or illness that may be going on? Other than that, I think you want someone you feel comfortable with. I think you want a hospital that's doing a good number of deliveries. I think you want a hospital that offers opportunity for you to deliver in a setting you like to deliver, with supportive nursing staff available. And I think it's extremely important that you have someone there to care for the baby and people that can evaluate your baby, because even though a majority of the time everything is totally perfect, it's not 100%. And you want to have the capability to take care of you and your baby if either one of you become ill.
Yeah. And our team at Rex is present to take care of any baby 24/7.
Yeah.
So
and
there's always
lovely.
someone around.
I kept on calling it the hotel. I kept on saying, "Are you guys coming to the hotel?" Oh wait, I'm in the hospital. So, Amanda from Wake Forest, what can she do to increase her breast milk? She's a 2-week-old baby.
Well, the one thing I would say is to continue to breastfeed the baby. It's a supply and demand. So if you do not demand of it, it will not supply. So she has to make sure that her baby is latching on correctly and nursing frequently. And usually for newborn breastfed babies, it's about every 2 to 3 hours. And if she did have any concerns with breast milk production, she should talk to her physician about possible supplements that she may be able to take, or maybe pumping that she may be able to add to her regimen in order to increase her supply.
A good lactation consultant in one of those
Absolutely.
offices.
And I think, and Rex also has very good lactation consultants that are available. The other thing I would remember too is it's summertime, it's very hot, you lose a lot of your fluids in perspiration. Make sure you keep yourself well hydrated. That's going to keep your breast milk supply up as well.
Absolutely.
Okay, thanks for your questions. We're going to answer as many as we can right after the break. This is Rex on Call. Welcome back to Rex on Call. If you're looking for a doctor or need a direct referral, call Rex Health Net. Here's that Rex telephone. It's a toll-free number, 919-784-4490. And now we have a final round of questions. This is from Natalie in Nightdale. What's the difference between acid reflux in a baby and gas? And how do you treat it?
Well, gas is fairly common in newborn babies, as we all know. For gas relief, really, I would recommend frequent burping of babies, and some babies don't like to burp, but you try to burp them. Acid reflux really involves the refluxing of the milk contents from the stomach up into the upper part of the chest. And there are some babies who reflux because they have an immature junction between their esophagus and their tummy, and they continue to gain weight, they're happy. I would say contact your physician if you notice that your baby seems uncomfortable from the reflux and they're not gaining weight, and they generally are not excited about feeding.
Yeah, and then there are some medications.
There are medications.
Okay, this is Cynthia from Kenley. She's a small frame, she's 9 weeks to go, and now the baby's breech. What does she do?
That's a really good question. 90% of babies are going to come out head down the way they're supposed to come out, and then some other babies are going to be in different positions. At 31 weeks, the baby may still turn. We don't get too worried about determining if a baby's breech until closer to 35 to 36 weeks. There have been all sorts of things people have looked at to try to turn the babies, and there's been nothing definitively in multiple studies that have shown to make a difference, except for sometimes physically trying to turn the baby at the hospital. And that's called an external cephalic version. If your baby is still breech at 35 to 36 weeks, you can speak with your doctor at that time.
Okay, for a question for you, just wanting clarification, is the pacifier okay for first month, and how does that impact the baby's ability to feed or nurse? We just want to clarify.
The pacifier is okay for the first month. Babies will learn how to breastfeed, and they will either learn how to take a bottle. There was a thought that babies had nipple confusion. However, it's not confusion in so much as it's nipple preference.
Right.
They prefer one over the other. And as we talked about earlier with non-nutritive sucking, sometimes babies need to have the sucking motion in order to comfort themselves. Other babies find their fingers, and it accomplishes the same thing.
Yeah, and that's actually our next question. 9 to 10-month-old sucks her fingers. Is that okay? So yes,
yes, it
is. And the pacifier is okay past a month. I know that just
yes,
for
it
the
is.
first month. Okay. Caller had or her son was yellow and jaundice. Now, what are some of the treatment? I know in the hospital they don't let you go home if you're jaundiced, but what are some ways to treat?
Well, in the hospital, we usually check the baby for jaundice before they leave the hospital, just to make sure that it's not high enough needing in-hospital treatment. If it's just plain jaundice that's not high enough to merit treatment, a lot of times we would recommend to parents that when they feed their baby, they feed them next to a window, not sunlight, but a window.
No sunbathing.
Just for, exactly, just for daylight purposes. And over the first couple weeks to 3 weeks, it should go down on its own. And breastfed babies sometimes keep their jaundice a little bit longer.
Of course they do. Okay, this question is from Carrie, our last question of the day. What are some important diet tips for pregnant moms or somebody planning to get pregnant? There's a lot of rules out there.
There are a lot of rules, and they can be very confusing. And one of the most frequent rules we just had was issues with seafood and avoiding certain fish and what to do. Well, there's a lot of really great nutrients in seafoods, a lot of omega fatty acids and DHAs, and a really good source of lean protein. The recommendation is 8 to 12 ounces a week. Try to avoid fish that have more mercury in them: tilefish, swordfish, king mackerel, and shark. Okay. But other than that, a well-balanced diet.
Okay. And as always, consult with your physician about any health concerns. Thank you, Phone Bank, for answering our questions over there, and thanks to those who called in and emailed questions today. Thank you guys for answering those questions. Join us next month for Rex on Call. The focus is your eyes. That's August 18th here at 1 on WRAL. Email your eye health questions ahead of time to rexoncall@rexhealth.com. Thank you so much for joining us. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.